Hello, my name is Kathleen Lesson. I am an oncology massage therapist. I'm a lymphedema therapist, and I'm a yoga teacher. And I'm excited to share this information in the presentation with you today about yoga and how it might help our oncology massage clients who have a cancer history. So let me share my slides and we will get right into it. Okay, so yoga for oncology massage therapists. My name's Kathleen Lisson. I'm a lymphedema therapist. I'm also a health coach. I started off as a personal trainer, and then I also am a Yoga Alliance RYT 200 and a yoga and meditation teacher. So the big question that we may have heard from our clients while we're giving them a massage, if they are recently had a cancer history, is, can yoga help me? What have you heard about yoga? And I want to arm you with some information, some research that you can look more deeply into. And then we'll eventually have resources that you can actually practice on the mat and feel these postures in your body. But for everything, the answer is a resounding yes. So let's start by quickly reviewing some information about the lymphatic system and lymphedema. So our lymphatic system, it transports water, fat, protein, and waste products from all the cells in our body back through the lymphatic system into the circulatory system. So when a client with a cancer history says they have lymphedema, they're talking about an accumulation of protein-rich fluid in their tissues as a result of damage or dysfunction of their lymphatic system. And our oncology clients can acquire secondary lymphedema as a side effect of cancer treatment. So if our clients don't have lymphedema, it's likely that they're worried about potentially getting lymphedema. But the good news is that the gentle movements and breathwork of yoga can help healthy lymphatic systems as well as lymphatics that need a little or a lot of help. So in this presentation, we are going to focus on published research. We are going to look at yoga as a stress reduction practice, and stress reduction does also affect the lymphatic system. We'll look at why yoga is beneficial for people specifically with a breast cancer history. It's beneficial for many people, but we'll look at research on breast cancer survivors. And we'll look at research that indicates that many people with a cancer history and with lymphedema, with or without lymphedema, may already be using yoga as part of their self-care routine. We'll also look at guidelines for adapting yoga for clients with upper or lower limb lymphedema, and we'll look at the specifics of what type of breathing may support the client's lymphatic flow and our own lymphatic flow as well. So first, I'd like to start off this presentation with a mindful moment. So this will be the first time that we can actually practice what's in the research in our own bodies. So I'll invite you to sit in a dignified yet relaxed position. And if you want to, you can even practice the mudra. So this is a mudra that is used in a yoga protocol. And you can just go ahead and put your hands palms facing up on your knees in this mudra if you'd like. And we'll just take 3 deeper breaths, and then I'll invite you to add in silently the affirmation, my senses turn inward and I relax in peace. And I'll invite you to take one last breath and finish your last breath. And you can relax your hands and come out of that short mindful moment. And we'll get into some of the research. So the first big question is, what is yoga? What is yoga? And how is yoga different from someone just doing some stretches on a mat or going to the gym and doing other types of exercises? So modern yoga typically comprises 3 elements in various combinations, but we're looking for physical postures, which you may be most familiar with, the shapes that we put ourselves in while we're on the yoga mat. Also, breathing techniques, including alternate nostril breathing and other types of breathing, which is also called pranayama. and also meditation or mental relaxation. So for a good, high quality yoga program that is shown in these evidence-based protocols, the yoga is including all three things. The clients are doing postures, the clients are doing breathing techniques, and meditation and mental relaxation is also a part of the intervention. So why is this holistic approach needed in these protocols? It aids in physical rehabilitation because they see improvements in flexibility and strength in lymphatic flow, but it also enhances the mental well-being of the participants. It reduces their stress and promotes relaxation because yoga is a stress reduction practices. And that's because what you're doing in yoga, the positions and the meditation are inducing a relaxation response. And the relaxation response is the other side of the coin from the body's stress response. And if you regularly experience this sense of rest, it creates antioxidant, anti-inflammatory changes that counteract the effects of stress in the body. So how can we tell, or if we had a conversation with a client that said, you know, I'm doing yoga, but I'm not sure it's really doing me any good. The person themselves that practices yoga, they can feel the change in stress. Their body can feel changes in their stress response. Also, the research looks at heart rate variability. So having a low heart rate variability can indicate current or future medical issues. So we're looking to raise the heart rate variability in the clients at the end of the intervention. And researchers have looked at the effects of mind-body exercises on heart rate variability and perceived stress and found significant reductions in perceived stress. They also found evidence for beneficial effects of yoga on heart rate variability and that they're actually more robust than Tai Chi. So we need to know that yoga practice, especially with the breast cancer related lymphedema clients, gives benefit, both physical and psychosocial effects of the client's lymphedema. So how can yoga actually affect our body's lymphatic system? It should be comfortable and it should stimulate our body's parasympathetic nervous system. And Terence Ryan from Oxford University says that the lymphatic system is dependent on body movements. So it benefits from yoga because of the movement aspect, but also yoga controls the autonomic stimuli, causing the muscular walls of collecting lymphatics to contract. We'll look at more research on the clinical practice guidelines on integrative therapies during and after breast cancer treatment. And they found high levels of evidence for mind-body practices, including yoga, to address common mental health concerns among breast cancer patients. And then my favorite, personal favorite, a systematic review of systematic reviews for interventions following treatment for breast cancer saw that yoga has shown effects on anxiety and quality of life. So when practiced correctly, yoga has many benefits for both people undergoing cancer treatment and those with lymphedema. But of course, the importance is practiced correctly. We can't just send our client who is, you know, maybe older, deconditioned, has a complex medical history into that hot, sweaty yoga class and expect them to get the same results as these participants in the online, in the published research protocols. But the good news is that many people with lymphedema may already be practicing yoga. So if you are feeling hesitant as a clinician to talk about yoga and get your clients potentially interested in yoga or suggested it as an alternative, as a form of exercise for them, know that a lot of our clients are already practicing yoga. In fact, Australian researchers, and this is over a decade ago, over a dozen years ago, sent a survey to members of the Lymphedema Association of Queensland, and they found that half of the respondents to this survey reported using at least one of 22 complementary and alternative medicine therapies to treat their lymphedema. And some of these therapies did include meditation and yoga. So we need to know that our clients are using these complementary and alternative medicine therapies. And I encourage you to see if they're open to learning more about yoga. And also the Mayo Clinic sent questionnaires to over 800 breast cancer survivors, and 63% of them stated that they included yoga in their self-care practices. And almost 90% stated that yoga did help improve their symptoms. So there are plenty of people out there with a cancer history that are living proof that yoga helps people after cancer treatment. So how can yoga be adapted for people with lymphedema? Because we want to keep our clients safe. We want to give our clients information that will keep them safe. So the biggest misconception that I've seen for yoga and lymphedema is that people instantly think, oh, it has to be chair yoga. She's talking about chair yoga. It has to be just like this gentle breathing and stretching. But I want to say, absolutely, if your client wants to be more active, they want to have a more active yoga practice, especially if they had a yoga practice before they had cancer, they can still practice safely on their mat. They just need to understand the adaptations that they can do. So the Journal of Lymphedema published an article featuring yoga guidelines for participants with breast cancer-related lymphedema, and here they are. Avoid heavy loading of the affected arm. So if the person has breast cancer, they have lymphedema in one arm, we're not doing any one-armed handstands. Restrict static posture, so you don't need to be still for a long period of time. They can move in their positions, encouraging continuous movement, including breathing exercises, which are also a good, solid part of all the published protocols that I read. Adapting, if it's a floor-based posture, if they do need a seated or standing option, we should be making sure that they have a seated or standing option. If they can't get on and off the floor easily, or if for whatever reason their floor-based postures are difficult for them. And then begin the practice with postures and movements, include the clearing of the lymphatics of the trunk, and then moving from distal to proximal in each arm. So we're going to see if we can look at some of these published research protocols that I'll share with you later, or videos that I'll share with you later, and you'll kind of see how easy it is, how many different ways you can begin a yoga session with clearing the lymphatics of the trunk. So what about yoga after breast cancer surgery? And I found some really good information on that as well. This research article from 2024 said post-surgical yoga can aid in quicker recovery by improving mobility and reducing scar tissue formation. Now, obviously, this is not someone is going for their hour-long yoga class 2 days after they had their mastectomy, but when combined with pharmacotherapy, yoga can help in managing side effects such as fatigue, pain, and insomnia, which can improve our clients' overall quality of life. So when the physician says they can get back to exercise, when the time is right for them, yoga can be an option for them as well. So I've kind of sprinkled in information in my urging you to also do breathing exercises and meditation exercises. But I want to bring it to a point, and that is, the question is, should we focus on more than asana? Why don't we just let them go to an asana class, and then that will be enough, just the postures and the exercises, to really get the benefits that are seen in these published protocols? And the answer is they need more because they're given more in these research protocols, because as a true practice, yoga is a spiritual discipline. And I don't want anyone to get scared here. It's not a religion, but it does include information on specific attitudes and behaviors like nonviolence, non-stealing, known as yamas and niyamas. So that is taught as part of many of these yoga protocols. And yoga also includes physical postures, which we have seen in videos, and then some breathing exercises, which I'll have I'll have resources for you. It also includes deeper states of mindfulness, kind of interiorization of the mind, progressively deeper states of concentration, where you're concentrating on one particular thing, and meditation, and then finally the concept of samadhi. So the researchers say in this context, all of these are considered valuable and practiced as a holistic package. Conceivably, all these elements could have therapeutic benefits for physical and mental health as well. So specifically the yamas and niyamas. In order to promote the proper attitude for the safe practice of the intervention and distinguish yoga from other therapies, the principles of yama and niyama should form a framework from which the instructor teaches the entire class. So this, if you're encouraging, if you're talking to someone, if you're giving them information about these research protocols, have them be able to know that yamas and niyamas, all the limbs of yoga are present in the published research protocols that have shown benefit for clients after a cancer history and with lymphedema. So let's talk a little bit about breathing and how breathing is involved in these yoga practices. So breathing during the Institute of Applied Dermatology yoga protocol asks participants to inhale during the limb extension and exhale during the limb flexion, and then the longer exhalation than inhalation. And pranayama practices like alternate nostril breathing and Bhastrika are also included in the protocols. And I have videos on both of those if you want to look at both of those. So I'll encourage you, if you watch this video and you're still watching, I feel like you're interested in yoga, you're passionate about helping your clients with a cancer history, and I would invite you to get on the mat and try some of these practices yourself, to give yourself kind of that internal physical confidence when you're having the conversation with your clients. So if you were to put these principles and practices, sessions begin with breath work and positions to facilitate central lymphatic drainage. And then we're doing asana to promote lymphatic drainage and reductions of symptoms caused by fibrosis. So I'll encourage you, take it to the mat, grab your yoga mat after this presentation and join me. I have a series of videos. They're short videos, and they kind of bring into our physical bodies these concepts that started in the published research. So it is at the address right here, and the series is called Yoga for Oncology Massage Therapists. So I am not a yoga therapist. I am not teaching oncology yoga, and you are not learning yoga from me. We're just standing together as colleagues, as fellow oncology massage therapists on our mats and trying these practices in our own bodies. And if you want to really dive deep into the literature, I'm finding more protocols all the time. But these are a few yoga protocols that you can type in the website addresses and really look at the nuts and bolts of what intervention was given to clients and what benefits that they were found. So thank you so much for attending this short presentation. I'll encourage you to follow me on Instagram at Stress Reduction for Lymphedema. I'll encourage you to go to my website, KathleenHelenLisson.com, and I'll encourage you to go to my YouTube channel and try some of the Yoga for Oncology Massage Therapists practices. And I also have other breathwork practices that you can try in videos as well. So here are the resources, And thank you so much for attending this presentation. And I look forward to seeing your comments in those Yoga for Oncology Massage Therapist videos. Leave a comment on the videos and let me know how you enjoy the class. Thanks and have a great day.